There are mounting concerns over rising COVID cases in several states, even as vaccinations ramp up across the country. U.S. health officials warn a fourth COVID surge is on the horizon as the UK variant spreads nationwide. The head of the National Institutes for Health tells CBS this morning the variant is probably, quote, 70% more contagious and significantly more lethal even for young people. Dr. Bob Lajita is with me now to talk more about this. He is the director of the Institute for Autoimmune and Rheumatic Diseases at St. Joseph Health. He's also a professor of medicine at Rutgers and New York Medical College. So, Dr. Bob, children accounted for nearly 1 in 5 U.S. COVID cases last week and join the rising number of people that are suffering from long-term COVID symptoms. What do we know about the serious and long-term impacts the virus could potentially have on a child's health?
Yeah, Vlad, this is of great concern. I'll tell you why. Because in about 15% of children, there are lingering symptoms. We see lingering symptoms in adults to the tune of about 35%, and in some young patients, that is between the age, I would say, of 25 to, say, 40, we are seeing symptoms that linger in about 40% of patients. But the children are concerning. There are two syndromes that one sees. One is an acute infection, which makes the child sick, rarely winds up in the hospital. And then there's the second, which is the multi-system inflammatory syndrome, which we've all heard about, that can occur 6 weeks to 6 months after the child suffers the infection. The side effects that you see are fatigue, you see headaches, you see heart palpitations, and the child really complains of listlessness and brain fog. It's sort of like chronic fatigue syndrome that we've been seeing in adults for many, many years. And this is of great concern to all doctors, but particularly pediatricians.
So, Doctor, as you know, mass vaccination sites in North Carolina and Colorado were closed this week after some people experienced adverse reactions to the Johnson & Johnson vaccine. What were those reactions, and is there any reason to worry?
Well, the reactions, Vlad, were disconcerting insofar as the patients became orthostatic, which means their blood pressures dropped. This is often seen in vaccination sites. Some patients pass out because they are afraid of the needle, or the needle actually causes a vasovagal response. So you have a feeling of faintness, lightheadedness. Sometimes the patients actually pass out. They develop rapid breathing. They become diaphoretic, which means they become very, very sweaty. And the patient will say to you, "Hey, I don't feel good. I just got this shot, and I better sit down." And that's why we keep them around for about 15 minutes after the injection. So these kinds of effects, for some reason, have been seen in various sites in the southern part of our country. And I don't know whether this is a mass effect or these are really the results of the J&J or the other injections that the patients have been getting.
So let me ask you about this, Doctor. There was an interesting op-ed in the Wall Street Journal over the weekend by Marty Mockery, who works at Johns Hopkins. He's a professor of medicine at Johns Hopkins School of Medicine. And he talked about herd immunity, and that he believes that while it's important for everyone to get vaccinated, he was very clear in his op-ed that everyone should be vaccinated. He does believe that that although vaccinated, I'm going to quote here, vaccinated immunity will prove more durable than natural immunity, and I think everyone should get vaccinated. But after a year of millions of COVID-19 cases, it's clear that reinfections are rare. Natural immunity is real and shouldn't be ignored. And this was sort of pushing back a little on Dr. Fauci's push for everybody to get vaccinated and the denial of this other type of immunity. What do you think about that?
Well, you know, Vlad, this is a complicated issue. There are two kinds of immunity. We call it innate immunity and adaptive immunity. And when you're infected with the virus, you develop both humoral, that means antibodies, or cellular immunity. I shouldn't say or, it's and cellular immunity. And we scientists think that cellular immunity is just as good, if not better, than adaptive immunity. That means the presence of the antibodies. So whether you're infected or you get the vaccine, your immune response is very, very strong, with few exceptions. Your immune response, particularly the cellular immunity, which involves all sorts of killer T cells that are specific in your body for viral infections, those are raised very highly. we still advise after you've had the COVID-19 to get vaccinated, because you can boost your immunity even higher by getting one of the vaccines, even after you've had the infection. So the good news is herd immunity is around the corner. Britain thinks it's going to be vis-a-vis their formulas occurring next week, actually. And that means that over 70 to 80% of the population needs to either have been infected or have gotten the vaccine to achieve herd immunity, which means then the virus is basically going to disappear for the most part for most of the population.
So when we talk about, the need for everybody to get vaccinated, and it's a message that is being driven by the COVID-19 task force, by Dr. Fauci, by others, are we sort of missing a little bit of the information that the American people should have in deciding? Because, there's been people who don't want to receive the vaccine, and no matter how many times you or I appear on television, no matter how many times Dr. Fauci appears on television, there's some people who are just not going to get the vaccine. Is that troublesome for you, or does this data suggest that they may be okay?
It's not troublesome for me, but, they're not doing their part by not getting the vaccine. The vaccine is essential for herd immunity. Now, once we achieve herd immunity, those who are not vaccinated, it won't matter, basically, because we will have enough people in the population to have herd immunity. This happened if you are old enough, and you're probably not old enough to remember the Salk and Sabin vaccine. I was a little kid, but when the Sabin vaccine came around, it was an oral vaccine on a sugar cube. The Salk vaccine had started to produce herd immunity, and once the sugar cube immunity from Dr. Sabin came around, there was herd immunity, and we virtually knocked out polio, whether you were vaccinated or not. The same thing is possibly going to happen here with the COVID-19 virus. I'm very hopeful, but I really still think everybody should do their part and get a vaccination. I really believe that.
Really interesting. Dr. Bob Lajita, thank you for breaking down a very complicated subject. As you said, once you started talking about cellular this and that, I started to lose it, but then you made it very, very clear exactly what you were saying to me and to our audience, and I appreciate it, and I'm sure they do as well. Thank you so much.
Thanks, Vlad.